All right, so just to introduce myself, my name is Melissa Borowski. I am the interim assistant vice president for health and counseling services. Great. It looks like the chat is disabled, but you guys can use the Q&A. So that is working for me. So that works if you need questions at all. But like I said, I'm the assistant vice president for University Health and Counseling Services. And I'm really excited to have your students here or have you here if you're going to be a student this year. And so just talking about some healthcare options when we're here on campus. So first of all, I just want to say welcome. We are so excited to have you and your student here at Case Western Reserve University. We know that this is a big change for those, especially if this is the first time for anybody having a student go off to college or move away. Even if it's not the first time, it's always a little hard to transition into kind of a new era of your life. And so that's what we're going to talk a little bit about is having a healthy transition to Case Western Reserve. And so the really great thing about Case Western is we have a wealth of resources when it comes to medical and mental health care. Not only on campus, but surrounding us. And so, rest assured that your student will be well taken care of while they're here. But this is a hard transition. You've seen them go from babies to toddlers to young adults to teenagers and now transitioning to adults and off on their own. And so I want to honor that and know that it's going to be difficult for both you and your student to move through this transition. And it's just going to be a little bit different than it was previously when they were children under your household. And so, one of the biggest things that we recommend for people to do is to plan, right? And so, you and your student, so you should both be involved in this planning, is really making sure that you're planning for emergencies, making sure they have everybody's emergency contacts, they know the information about public safety here, which we'll talk about, and any other type of emergencies that might come around. And so, planning for failure and disappointment, what we know about Case Western students is that they are the brightest students in most of their high schools. They are overachievers and they really are shooting for the stars when it comes to their goals. And this might be the first time that they have failure or disappointment in their academic career. And so maybe they don't get into an internship or maybe they don't do as well on a test that they thought they were going to do well on, or maybe they've decided they come in pre-med really wanting to go into medicine, and they realize that that's really not what they want to do, and so they might be worried about disappointing you or your family, and so really making sure we're planning and talking through those things, and letting them know that failure and disappointment is going to be normal during this time of their life. And then a really big one that we'll highlight a lot today is planning for medical and mental health care. So one of the biggest things to do for planning for emergencies is for your student to download the Spartan Safe app. I recommend that all students have this app on their phone. Right when they get to university, even if they can do it right before. And so you download the Spartan Safe app, and as you can see, this is what they're going to use not only for emergencies, but there's also a lot of resources on here. And so there's maps. You can tell a friend that you're walking. You can make an emergency call. One of the really great things is that you can chat with public safety. And so if your students in a place where they can't actually speak or verbalize what's going on, they can chat, and then that support resources right there in the middle actually has phone numbers that can call health and counseling services and other resources on campus. And then the bottom left one there, emergency plans, is where you can sit down with your student and put in what your plans are going to be in various emergencies. You want to make sure that your student has a copy of medical insurance, pharmacy insurance, dental insurance, all of those insurance cards. You may be surprised, or maybe you won't be surprised, of how many students come to see us and they don't know anything about their health insurance, what's covered, what's not covered, anything like that. And so I do already see a couple of questions about health insurance in the chat. And so I will be talking about health insurance quite a bit. So hopefully we'll be able to answer those questions. If not, I'll get to them at the end. making sure all of their emergency contacts are updated in what we call SIS, the Student Information System. So whoever their emergency contacts are should all be in there, because I'll talk about this later, but we do contact emergency contacts if somebody is hospitalized or if there is an emergency on campus. And then making sure they have a list of all medications with dosage and any allergies that they might have, and making sure they understand what those medications are for and how to get a refill for them. And I'll talk a little bit about medications in a minute, but making sure they understand how to actually read that label of their medication, and then making sure that these phone numbers are in your student's phone. So 216-368-3333 is for our public safety. So any student who is on campus experiencing emergency, that's who they would call. And then 988 is the Suicide and Crisis Lifeline. That's for anybody in the United States can use 988 if they're feeling like they're in a mental health crisis. And then I'll talk about our phone numbers for health and counseling services also. So this is probably after insurance questions, this is the number one question we get from parents at the beginning of each academic year. And so just to touch on medical power attorneys, release of information, all of that. So one of the biggest transitions that are is a little bit difficult for parents is, especially if your student is over the age of 18, they are an officially adult and their health record is no longer accessible by parents. And so kind of knowing and talking through that and what that means, and talking with your student about what they will be comfortable sharing and what they should be sharing with you and what they should not be sharing. We are happy to upload power of attorneys, advanced directives, those things into our chart, but it does not give parents carte blanche access to students' health records. Students are able to sign releases of information. Those are found in our EMR system. But again, it's really per instance. It doesn't mean we're going to talk to the parent about everything that's going on with the child or the student. And so really kind of understanding that, talking to your student about making sure they're talking to you about what's going on. But in saying that, I will also say that our providers, both mental health and medical, are really good about also talking to the student when we believe we need to start involving parents in their care. And like I said before, we do notify parents or any other emergency contact that's listed. So they do have to be listed as an emergency contact. In case of emergencies or hospitalizations. And so you will know if your student is hospitalized or if there's an emergency, but we really only discuss health conditions on a case by case manner. And that has to be at the request of the student. So a little bit about planning for failure and disappointment. And so again, really making sure, especially if you know if there's students on here, you as a student or you as the parent know that your student does have anxiety, depression, gets really stressed out, anything like that, that they really have a plan for how they're going to deal with that when that comes, because we know that college is stressful. It is hard, right? And so making sure that there are plans and resources, and you'll learn about a lot of those resources today, but talking through them of what skills they might need to work through anxiety, stress, disappointment, those types of things, and what are healthy ways to do that and what are unhealthy ways to do that. And so on our website, we do have this document that kind of outlines how you can make a mental health plan. So again, if you know your student may again suffer from anxiety, depression, um, anxiousness, anything like that, let's make sure we're filling out the plan here. Has our phone numbers on it, talks about what their stressors typically are and how they're going to manage those. So I encourage you to look at that site and download that plan and work with your student to have that done by the time that they get here to campus. So, planning for medical and mental health care. So, like I said, the Cleveland, one great thing about Cleveland is we're really rich in medical and mental health care. If you remember, if you visited campus, we have healthcare on campus, but then we are literally next door to both university hospitals and Cleveland Clinic. Metro Hospital is not far away. If you're somebody in the military, the VA hospital is also right down the road. And then there's a lot of private practices and private mental health clinicians that are in the area too. And so that's a really great thing about being in Cleveland. And so there's a couple options that we talk about as students are transitioning into their first year of college. And knowing their care options. And so we always tell people, and I'll talk a lot about our services in a minute, that they should start with University Health and Counseling Services. We work similar to any primary care or acute care facility, and then we also have mental health care. So I'll talk about that. The really great thing about University Health and Counseling Services is that we are no cost to students. So as long as they're enrolled in 1 credit hour, they're able to utilize our services. The other thing is is continuing care with clinicians at home. And so you and your student should have a conversation with your clinician to see if that's the best route for you or to see if it's even possible. Sometimes clinicians cannot provide care across state lines, depending on what it is. And so if the plan is that the student comes home to receive that care, and then making sure that we're working that in with their schedule, or if they're able to do virtual care or care through messaging, or if they create a care plan for the student, but really making sure that you're talking through those options with your clinician at home. And then the other option is off-campus clinicians in Cleveland. And so this is especially important for those who have chronic conditions. You're already seeing specialists. You're already seeing a mental health provider. I'll talk about our services. And so while we do provide a lot of medical and mental health services, we aren't specialists and we aren't a place where if you need chronic care or ongoing care for either medical or mental health, that we would really refer you to places in the area for that. Um, but we'll get more in depth about that in a minute. So really just a little bit about University Health and Counseling Services here. And so we are an integrated department. So we have medical, mental health, wellness underneath us, public health. We also have the medical plan underneath us. And so kind of all of the healthcare for students is underneath one umbrella. And so for medical services, we do a lot of injury and illness care, immunization, sexual reproductive health. We do have primary care, and so we can see students for kind of basic primary care needs. For mental health services, we do what's called brief individual counseling. And so that's typically problem focused and short term. Students can receive up to 12 free individual counseling sessions per week. And that's ongoing care. And so I'll talk a little bit about, so we do same day or next day appointments. And so students can have an ongoing counselor that they see for those 12 sessions. But if they need care in between time, in between those sessions, they also can do a same day. It just wouldn't be with that same provider. And so the really great thing about that is that there's always access to mental health care here on campus. We also do group counseling, some skill building and workshops, and then we do have psychiatry on campus. So again, our psychiatry is going to be no cost. The medications will be billed to insurance because they'll be filled at a pharmacy, and that pharmacy will bill the insurance. But this is kind of why we say you should start with health and counseling services, is because we can figure out what's going on if we're not able to provide the level of care that the student needs. We really know the area hospital systems and providers. We look at insurance to make sure we can refer you to the most appropriate provider in the area. So again, the way we work, how you establish care for us for both medical and mental health is you do a same day or next day appointment. And so our same days and next day appointments work on a 24-hour rolling basis. And so if the student would go on to My Health Connect, that case.edu right now, they'd see anything that's available for the next 24 hours. So that's going to be anything that's available from 9 a.m. tomorrow, most likely through about 4:30 p.m., which is our last session for tomorrow. Um, And so that's where they schedule it. They should be familiar with My Health Connect at K-Stat EDU right now because the students have had to fill out their health history form and upload immunizations, and that's also where the insurance waiver is if they've done that. And so our hours are typically Monday through Friday, about 9 a.m. to 4:30 p.m. We do close from 12 to 1 every day. Um, but the really great thing is, and I'll talk about timely care, is that we always have after hours services available. And so our main numbers are on the screen right there. So both of those numbers are what you would call during the day to reach us if you had questions or to schedule an appointment. But they also serve as our counselor on call and our nurse on call phone numbers. So again, 24 hours a day, if somebody called those numbers, they'd be able to be connected to care. Um, so again, that's just some information so they can schedule the appointment online. That's the easiest and quickest way to do an appointment, especially if it's after hours. Our two phone numbers, and then timely care is available to them also. And so I'm going to go back for a second. So timely care is a partner of ours that provides 24/7 virtual medical and mental health care. And so students can actually connect to a medical or a mental health provider virtually, usually within 5 minutes, most of the time, even less than that. And so I really think it's important that students download the Timely Care app on their phone. As soon as they step here on campus, they are eligible for both our services and Timely Care services. Timely Care is also something that they can use if they go home for the weekend. If they're enrolled in spring and enrolled in fall, they can use it over the summer when they're at home. Again, it's no cost and it's really a great option if they're feeling sick and it's midnight, or if it's Christmas or any of those other times. I really, 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 really encourage y'all to have your students download the Timely Care app. They would just log in with their network IDs. It may tell them they're not eligible right at the moment, but again, as soon as they step on campus in January, they will be eligible. So just a little bit about prescriptions. We can continue to prescribe most medications for students. Some medications may require them to come in and have a visit and see a specialist. What I recommend is that you call and make an appointment, or they can send secure messages through myhealthconnect.case.edu to nurse refill, and they'll be able to let us know if we can continue it. ADHD medications are slightly different. We do need to have documentation that they have been diagnosed with ADHD, and done the appropriate testing for that. And then we're able to kind of transition the ADHD medications over to us. There are several pharmacies in the area. One is right across from UHCS, and I did get a question about where we're located, and I'll show you that in just a second. But there's a pharmacy right in University Hospitals called Bulwell Pharmacy. That's directly across from our building. There's also a pharmacy in the Cleveland Clinic, and there is a CVS just down the road in Euclid. Those are the closest pharmacies to us. So again, just a little bit more about timely care. So there's a few different options for engaging with timely care. Talk Now is basically 24/7 in the moment support. So this is a non-scheduled visit where you're able to connect with a mental health professional within 5 minutes of getting onto the app and requesting to be seen. And so this is, again, really great if somebody is struggling at night, on the weekends, even during the day, and they don't have an appointment with us yet. They'll get an appointment quicker with timely care than they typically would with us. We receive all of the timely care notes, so we know who's utilizing timely care. We're able to know if we need to reach out. Timely care also knows our protocol to if somebody is in crisis and how to do wellness checks and get help to them in the location that they're at. You also can do scheduled counseling. And the great thing about scheduled counseling is, again, it can be nights, weekends. You're able to pick a counselor that maybe identifies more closely with your identities, and that can be ongoing also. Timely care follows the same structure as us, where their scheduled counseling visits are limited to about 12 per year. But you can do talk nows whenever you need to do talk nows. And then there's also medical visits that can be scheduled or in the moment. And that's really good for illnesses. Again, if you're not feeling well and you think you need to be seen, you could do a timely care visit for free, and they're able to tell you, yeah, let's get you to an urgent care, let's get you to an ER, or here I can make a prescription for you, and you can do that instead. So again, it's no cost. It's a really great place to start. Timely care also has a lot of workshops and classes. So they have guided meditation, they have yoga, lots of informational, educational workshops. And then they also have a peer support network there where other students from across colleges can talk to each other about what they're going through in college. It is monitored by a mental health professional. And again, if you're with your student, they're welcome to scan to download, or they just go to timelycare.com/CWRU, or they go to their app store and just put in Timely Care, and then they'll be prompted to pick Case Western and go from there. So just a little bit about paying for care. So again, we really encourage students to start at health and counseling services because our visits are no cost. And now, if we do need to do prescriptions, labs, x-rays, we send those things out to outside entities, typically Quest, our university hospitals. And so it would be really important for you to check with your insurance provider to make sure University Hospitals and Quest is covered under your insurance plan, because those entities will then bill health insurance for the lab. Again, if the care is too high for what we can do at University Health and Counseling Services, we will refer you to the appropriate, or your student to the appropriate specialist in the area. We're going to talk about insurance a little bit in the next couple of slides, but it's really, really important that the students know the details of their insurance. They know how to call to ask questions of insurance. They know who has their insurance. Any of those things really needs to make sure that they understand that it is the responsibility of the student to make sure they understand their insurance. And hopefully the parents can help with that a little bit also. Um, and this is a little different, especially for our international students, is that you really should plan to pay some of the costs yourself if you're being seen at other locations outside of health and counseling services. But even with us, medications, labs, x-rays, some immunizations, those are going to be things that are going to cost money to the student. And then making sure that you and your student understand what the copays and deductibles will be for any visits that are outside of University Health and Counseling Services. So a little bit about our medical plan. So the university does require that all students have medical insurance. And so the insurance does have to be comparable to the Aetna medical plan. You do not have to have the Aetna medical plan. And so if your student is still covered under your health insurance and it meets the waiver criteria, then they can waive out of the health insurance plan. One of the biggest things I will probably talk about a few times in this presentation is that the plan has to cover them in Ohio, particularly Northeast Ohio. And so I would really take a little time to go through your plan, to call your insurance plan, to make sure it covers Cleveland Clinic, university hospitals, Metro Health. And again, if you're in the VA, then you're most likely covered through that. But those three are the main hospital systems in our area, and so you really want to make sure that they can be covered. So I will tell you, Kaiser Permanente is not in Ohio. Kaiser Permanente should not be utilized by your student while they're here. We have had several instances where students have Kaiser Permanente and they don't even have an emergency. They just have some routine lab work done or just an x-ray done, and it ends up costing them tens of thousands of dollars. Same thing with out-of-state Medicaid, travel insurance, those types of things. So unfortunately, with our international students, there's companies out there that market heavily to our international students travel insurance plans. And so the insurance company has to be able to do work in the United States and needs to cover you for emergencies and non-emergencies in the state of Ohio. And so really, really, really look through your insurance plan. And if your plan does not meet that criteria, then you need to be on the Aetna student health plan. And again, emergencies are one thing, but we've seen bills really, really high for non-emergent situations. And there is not much the university can do about that. Because we have put this criteria in place for a reason to help with covering some of those costs. And again, UHCS, so it's confusing because we do require that students have health insurance, but health and counseling services, we do not require students have any particular type of health insurance to utilize us. It does not matter what they have. All students can utilize health and counseling services. Doesn't matter if they're undergrad, grad, professional, international, they're on their mom's insurance, they're on their dad's insurance, they're on their husband's insurance. It does not matter. Anybody can use health and counseling services. So I just want to make sure that I clarify that as we move forward. The health insurance requirement is really to protect students if they need to utilize anything outside of health and counseling services. So I am going to tell you if you have very specific questions about whether or not your medical plan meets the criteria, you first need to look at the criteria on the website um, and then call your insurance company. You can also email medicalplan@case.edu. But just remember that if you're going to waive the plan, that does need to be done by January 23rd. If you do not do it by January 23rd, your student is automatically renewed or enrolled into the Aetna medical plan. So I'm gonna just look because there's a lot of questions about insurance in here. So I just want to get to those while I've talked about that. Um, so question around, I have an OAP plan PPO through Cigna. Wanted to understand how this works at CWRU. And so again, I really think that you need to call Cigna and make sure that your plan covers the Cleveland Clinic, University Hospitals, Metro Health. And so just talk to them about that. Again, your student can use University Health and Counseling Services regardless, but if we have to send labs out or x-rays or refer them to a specialist, they're going to need that. We do, the next question was for out-of-state students, does CWRU provide health insurance? Yes, they can enroll in the Aetna Student Health Plan. Again, is UHCS care under most insurance plans? We do not. We are actually in no insurance plans because we do not take health insurance. The monthly insurance premium is going to be on our website. So I encourage you, I'll put the website up at the end of the presentation, and you should be able to grab that from there. I believe it's a little over 1,900 a semester. I do not have information on Cigna PPO. And so again, you're going to need to call Cigna because I don't do anything with Cigna or any outside health insurances. So you really have to kind of dig into that yourself. All insurances are a little bit differently. Okay, so I'm going to keep going here. So one of the biggest things you can do to support your student is to have them start to make their own doctor's and dentist appointments. This is really an important skill for the students to have. What we will tell you is that if you call Health and Counseling Services to make an appointment for your student, we will not make that appointment. Your student has to be the one that calls to make the appointments. What we have found a lot of times is if a parent makes the appointment, the student either does not show up or comes and it's really not beneficial to them because they're not there. I wouldn't say in their own free will, but they're there reluctantly, right? And so it's not as impactful as it could be if they made the appointment on their own. And so we really encourage you to encourage your student to make the appointments. I will talk about what to do if you're worried about your student in a little bit. But we also encourage you to pack a basic first aid kit for your student to keep in the residence halls. We do have wellness vending machines across campus. There's 5 that are available, and we have some basic medications, first aid, sexual reproductive health care items in the vending machines at a much lower cost than they'll find at any CVS or Walgreens. And so there's one in Fribley, there's one in Wade, there's one at the health education campus, at the TVUC, and at this year's library building. And so they can also purchase them, but I even sent my niece with a big first aid kit that had allergy medicines, Tylenol, stomach things for stomach aches, those types of things. And she like, I was surprised at how excited she was over something like that. So just making sure they have that. And she asked for a refill this year when she went for her sophomore year. So having some basic supplies there is going to be really helpful. We really want you to start talking to your student about sex, about alcohol and other drugs, about other healthy habits. If you have those conversations or if you bring them up casually, it really allows them to reach out to you if they might be struggling with any of this stuff and have open conversations with you about these topics, mental health, all of that. And so the QR code on the screen goes to a website called College Parents Matter, Have the Conversation, and it gives you really great resources on how to ask questions, how to have conversations, what to ask about. And so if you're either nervous or not really sure how to start those conversations, I encourage you to go to that website. Has really great resources for y'all. And so one of the biggest thing is knowing the resources. So we did get a question in the chat about knowing about where health and counseling is located. And so our building is not the easiest to find. We'll admit that. We are in what's called the Dental Research Building. And so this road right here is Cornell Road. It goes, if you keep traveling up this way, it hits Euclid. And so most of you, if you come to campus or if your student comes to campus, you'll know that there's a Starbucks right there. So there's a Starbucks that's in a bank. If you go down the road that's right next to the Starbucks, our building is going to be right here on the right. If you keep following this road, it gets you to Little Italy. And then this road gets you to where the windmill is, if you know that power windmill and the Veal parking garage. This right here is the biomedical research building, and this right here is university hospitals. And so again, we are in the dental research building, and the pharmacy is actually right here. So it's fairly close to the South Side Residential Village. Those are those train tracks, if you remember that. But it's a little bit of a walk from the North Residential Village. There is a bus stop that stops right here in front of the Wolstein Research Building. And there is an entrance to our building. There's actually a building underneath this green stuff right here. There's an entrance to the building right here too. This building right now is under construction. So if you've hit a bunch of construction, you're in the right spot. But it is a little bit difficult to find. You can just call us if the student is getting a little lost. Getting a flu shot is recommended. We do have flu shots right now, and we will have them through typically about March. So the student can make an appointment with health and counseling to get a flu shot if they have not already. Those are completely free to students. We are not providing COVID vaccines this year with the not completely the government recommendations are a little hazy right now, and they didn't completely support giving COVID vaccines to those under the age of 65. And so we weren't able to provide them this year. So when you are worried, and you will be worried, but if you're starting to get an inkling that your student is struggling, is not doing well, is really having a hard time with their mental health, is maybe even having a hard time connecting with other students, or is having a hard time in general academically, anything like that, we really want you to have those conversations with your student, and try to talk to them. And there's going to be times where they may not talk to you, or may not want to talk to you, or may not just tell you because they don't want to worry you, anything like that. If that's the case, we really encourage you to complete a care referral. And so the care referral is on the Dean of Students website. Um, and what that does is it basically provides an opportunity for the Dean of Students to refer or to read through what's going on with the student, and then reach out to the student. And so the great thing about that is the Dean of Students is non-confidential. And so they're able to do wellness checks, they're able to reach out. And then what they're able to do is have a conversation with their student, but then also have a conversation with other faculty and staff that may be surrounding that student. And so if they're athletes, they'll talk with their coach or their trainer. They're in the residence halls, they'll talk with their RCD. If they're in Greek life, they'll talk to Greek life. They'll talk with their undergraduate advisor, and so we're making sure, and then they'll bring us into the conversation also. And so we are confidential. And so, we only share what the student has allowed us to share. But we really kind of put a circle around that student to make sure that they have the support they need. So again, it's a really great option. If parents call us, again, any information that we get is confidential, regardless of who it comes from. And so if you call us, we're actually not able to do a reach out because that information is confidential. We will most likely encourage you to do a care referral, with the Dean of Students if you're concerned. I will also say if you're concerned and you're immediately concerned, if you think the student is at risk of harming themselves or others, then you're going to want to call campus police. I don't think I have this in these slides actually, so I'll need to update them. But our police department, all of the police officers go through crisis intervention training, so they know how to interact with somebody who might be struggling with mental health. In addition, we actually have crisis counselors that are embedded within our public safety department. And so if the crisis counselor is on shift, and available, they'll be able to respond to any mental health calls that might come through our dispatch. But I highly encourage you, again, if you're worried about your student, and you're worried about their immediate safety, then we're calling dispatch. We're not trying to make an appointment. We're not doing care referral. We're not doing all of that. We're calling dispatch immediately. You are able to consult with us. So again, if you're worried about your student, maybe you haven't heard from them, or they're saying things or doing things that just aren't like them, you are welcome to call us and consult, with with our counselors. And so we're always happy to talk to parents and talk them through what the options are to support their students also. But kind of going back to that, we will not be able to tell you whether or not your student is seeing us, or what has happened if they have seen us, unless we have a release of information from your student. And so, unfortunately, I know that's a frustration for parents, but it is a privacy with your student being an adult. We only are able to share if we have releases of information. So in addition to our clinical services, we also have the wellness program, where we do lots of educational programs, through our wellness department. The Dean of Students also has basic needs resources, and so I encourage you to pop around their website a little bit. They have lots of resources when it comes to food insecurity and housing insecurity. They talk a lot about, SNAP benefits typically. Hopefully those things come back, and any other resources that are available to students who may struggle a little bit financially. And so some of our wellness programs, these are ones that we do on an ongoing basis. So mindful activity hours, those are typically crafts, students do, and they just kind of have a little bit of time to chill. We actually had a student, leave one of our mindful activity hours and call their mom and say, "Mom, I didn't know that I needed to paint a pumpkin today, but I feel so much better." And so that was really kind of, encouraging to hear. And then the mental health trainings, we have two mental health trainings that we do. One is called Mental Health Ally. That is a 1 hour training that talks about how to recognize if someone is struggling, how to have a conversation, and then specific resources on the Case Western Reserve campus for those individuals. And then we also do mental health first aid, which is a evidence-based national training that is an 8 hour training that goes just a little bit more in depth on different mental health conditions, how to have conversations, what resources are available nationally. And so those are available to students, faculty, and staff on campus. And then just a couple more about this programs. And so some additional things to stay connected. Campus groups, I would again encourage your students to download the campus group apps. That's where we put all of the events and activities that are happening on campus. We also have a newsletter that we send out monthly with all of our resources, upcoming programs, any changes to services. So highly encourage your student to join our campus groups page so that they can get our newsletter. The Reach Out app has a lot of the resources that I talked about today right in one app. And then we are on Facebook and Instagram. And so this is the website I was talking about earlier that has all of the resources on the medical plan, on our services, again, our location, so you can have it in the map, all of the phone numbers. So case.edu/student-life/health counseling. I encourage you all to put that in your favorites in your bookmark bar so that you have that kind of ready to go. Same thing with your student. And then these are the top three here are all national resources. So we talked a little bit about the 988 Suicide and Crisis Lifeline. So that's a national resource that gets people connected to mental health professionals. The crisis text line is a really great option. The 988 line has texting options too, but the crisis text line is really good for people who maybe can't verbalize how they're feeling, but they can text it. It's also good if somebody has a language barrier or they're just a little afraid that somebody may not understand how they're feeling. That's a really great option. And then the Trevor Lifeline is for LGBTQ folks. Spartan Safe, we talked about at the beginning. So that is the app for our public safety department. And then I'll leave these up on the screen as I start to go through the questions because I believe this is the end of it. So just again, 2 QR codes, myhealthconnect.case.edu. Only students are going to be able to log into that. It is a single sign-on, and then they'll just enter their birth dates into it. And then Timely Care, again, is a really great resource for virtual 24/7 medical and mental health support. So let me just go through these questions, make sure I didn't miss anything here. I think I answered most of the insurance questions. I answered where we're located. The address for us is 2124 Cornell. We are on the first floor. So just a little bit more about our building. There's a ground floor, a first floor, a second floor. So the ground floor, if you remember from that picture, there's that green space. It's actually underneath that green space. And then we're up on what's called the podium level on the first and second floor. So health services on the first, counseling is on the second floor. Somebody asked about the slides being available. We're actually recording this, and so I think they're going to send it out with the next parent newsletter, so you'll be able to get that recording then. Put the list of hospital systems you just mentioned. So I'm going to try to put it in the chat and see if you all see it. So Cleveland Clinic, University Hospitals. And so just to distinct, we are different than university hospitals. That's a hospital system. We're University Health and Counseling Services and Metro Health. I don't know if you'll be able to see that in the chat or not, but here's hoping. Okay. Waiving the insurance plan is done through myhealthconnect.case.edu. And so you'll be able to kind of see there's an insurance waiver there. You will have to upload a copy of your insurance card and put in the information about your insurance plan to make sure that it meets the criteria for the waiver. And then I answered about the copy of this presentation. So again, you'll get the recording in the next newsletter, I believe. I think that's all the questions. Typically, I get a lot of insurance questions, so I was ready for those ones. Okay, sorry, I'm just going through these again just to make sure that I haven't missed any. Please feel free to keep putting them in there. Out-of-state students. Yep, I got that one done. Does UHCS provide preventative care such as annual examination? We do. You can do a physical through Health and Counseling Services. They just need to go to My Health Connect and schedule probably a primary care visit for that. We do not provide dental or eye care. The dental clinic is just a little bit further down. So if you have the Aetna Student Health Plan, your that covers you at the student dental clinic through the School of Dental Medicine. Again, that's just a little bit further down from us, closer to where the Cleveland Clinic is, easily walkable. Vision care, there is some vision covered under the Aetna Student Health Plan, but you'll have to look into who's available for that, and it's pretty minimum. We do offer supplementary dental and vision insurance that you can buy in addition to the plan that covers you a little bit more robustly than the basic plan. All of that information is on the website. For student, we have medical insurance for fall. Um, So for a student waive medical insurance for the fall, do they have to waive again for spring? We actually like them to be on the case plan for spring. So typically you have to waive once per year in the fall, right? And so if you don't ever want them to be on the case plan, they do have to do it every single year. Sophie, you're the person who asked this question. I would have you email medicalplan@case.edu. There may have to be a qualifying event for you to change plans, but this is a really great time to do that if not. So I would go ahead and email them. Luis is our medical plan manager. She's very quick at responding, and so she can help you out with navigating if you do want to change to the Aetna Student Health Plan. You're welcome. Okay. They're from California. We switched from Kaiser to United Healthcare Plan. Your employer and coverage began January 2026. For any healthcare needs, we reach out to UHS first. Yeah, I would. I apologize if you hear my dog howling. I would always have them start with University Health and Counseling Services, and then we can navigate from there. Obviously, if it's an emergency or a specialist, they may go to university hospitals. But I would encourage you and your student to know how you would be able to look up whether or not those individuals are in network for your plan. United Healthcare is typically covered in most places unless it's a weird plan. But I would have them start with health and counseling, and then we can help them navigate where they need to go. I have no idea if Anthem PPO plan is covered for university hospitals. Again, if you have a very specific plan, you need to call them and you need to ask them about university hospitals. So again, just a reminder, University Health and Counseling Services is the Case Western clinic. University hospitals is something completely different. So all students, regardless of what insurance they have, can use University Health and Counseling Services. University hospitals is if they need labs, specialists, anything else. Those are those three hospital systems I mentioned before. So you again will have to kind of look into that a little bit yourself. Anthem typically is covered most places, but I'm not going to guarantee that it will be.